My name is Jane Tiller and I'm an ethical, legal and social advisor in Public Health Genomics at Monash University. I'm a genetic counsellor and a researcher and also a lawyer by training. I think genetics is really starting to have a bit of a revolution, and that sounds a bit funny because people have been saying that for 30 years. We've known about the BRCA gene for decades, and there are other genetic conditions and genes that we know about that we've known about for a long time, but it's been very expensive. And so for a long time, although we've had genetic knowledge, it's really been done in a very small niche area. It's only for people who we know already are very high risk because of their family history or they've already had disease. And it's something that people talk about, this genomics revolution, but it's only now that the cost is really starting to come down, that we're starting to think about this population lens, that genomics is starting to become a part of mainstream healthcare. And so we're seeing this genomics revolution actually starting to pick up some pace in terms of clinical reality. And also we're starting to think about prevention and population screening in a different way. We're talking about how we can get ahead, how we can prevent disease. And this is another tool for finding out who are the high-risk people, how do we stratify risk, how do we make sure that these people are getting preventive care. And that's one of the trends that we're seeing at the moment.
DNA screening was something that I was always interested in doing. My mother had breast cancer, her mother had breast cancer, and also my father's mother had breast cancer.
Lovely to meet you all. Like Paul said, I'm one of the co-lead of DNA Screen. I've been working with Paul on this for a long time, and I'm delighted to have all of these people in the room that have only been named on a page for so long.
We proposed the idea in a research grant to the federal government in, I think it was 2021, to start using genetic testing before disease happens rather than after. So you can do something about your risk once you know you carry a variant in one of these genes. And it might make a huge difference if you know about it early. It could be life-saving information.
I didn't know a lot about the BRCA gene, but then I had the support of genetic counsellors that talked me through all the information that I needed to know. They spoke me through the process around setting up appointments with doctors, breast specialists, and I started having further conversations around what my options were. I started to feel a lot more empowered because I can now take the necessary steps to prevent the possibility of having breast cancer or even ovarian cancer. I get to live a long life, hopefully, with my husband, where one day we'll be able to have kids and I'll be able to pass this knowledge on to my children as well.
At the moment, there are a few main things that I do with my work. One of the primary things I work on is DNA Screen. And DNA Screen is a pilot study of preventive genomic screening. We want to move into this era where we can use genomics at the population level to test people for really high genetic risk of disease where there are things we can do about it. So we call it medically actionable. If there are things that we can do to prevent the disease that we know people are at risk of, we want them to have that information if that's something of interest to them. DNA Screen was a pilot study that we've now completed. We tested 10,000 young people between 18 and 40. We had a huge interest in that study. We had tens of thousands of young people signing up and asking to be part of the study. And overall, out of the 10,000 people we tested, we had about 2%, so 1 in 50, who had a high-risk gene in one of just 3 conditions that led to hereditary breast and ovarian cancer, Lynch syndrome, and genetic high cholesterol or familial hypercholesterolemia. That's been really rewarding because we've been able to actually have real world impact as we do this study. We've got people actual results, we've got them into clinical care, those people are now able to access prevention, and we're also building the foundation for how we move into a population screening program for genomics at a larger scale. Also on the other side, understanding what the barriers might be for people engaging in screening. What are the fears, what are the ethical challenges, and what are the things that we need to address either at a clinical level, at a society level, or at a legislative level to protect people's genetic data and information so that they can be confident to have this kind of screening without worrying what will happen with that. I've had quite an interesting educational journey. I started out doing a double degree in science and law. I was really interested in genetics and also in law. After that, I became a lawyer for a number of years. I was a corporate litigator, and I really missed science, I missed genetics, I missed public health, and had a real passion for that. And so I came back and did my master's in genetic counselling in 2016, and after that I went on to do a PhD in these public health issues around genomics, public health, and ethical, legal, social issues. One of the things I've learned is that healthcare is not a single track role. We think of healthcare and sometimes we think about either research or we think about people who are clinically caring for people, doctors, nurses, and all of those things are incredibly important. But I have increasingly learned that there are a huge number of roles in healthcare that both support and progress the really important side of things like policy. And as I've moved into a lot of policy work and have spent time with politicians explaining to them how clinical policy affects public health and affects people, and also how some of these legal and ethical issues interact with public health, it's really shown me that people with a really wide range of skills can get involved in healthcare, can get involved in healthcare policy, and can use the things that they know and the expertise they have to have an impact in public health. I've always been really passionate about public health, and I've always been incredibly interested in genomics and love understanding how genomics at the very base level can drive everything in humans. From my undergraduate days, genomics was my absolutely favourite area of study. I loved it and I couldn't get enough of it. I was not interested in any way in working in a lab. So pipetting and machines were not my interest. It was really that level of how can we use this information to understand the human body, to understand the human condition, and then increasingly, how can we use this information to start preventing disease? And for a long time, I went away and worked as a lawyer and loved that. I was very good at law and I really have a good legal mind. But the things that really got me interested when I was a lawyer were things where there were expert reports around scientific issues. I really loved delving into those reports. I loved working with scientists around evidence. And so it really showed me that the area I wanted to move into was back into that science and public health realm. And I've had amazing opportunities to use that information, use my different skills to progress that public health aim. And I'm now in a position where I can say the work I am doing is actually progressing public health outcomes for people. And hopefully, as I progress through my career, I will have more and more impact at that front end.